Hi guys, and welcome to my channel. My name is Stephanie. I'm a BSN RN. In this channel I talk a lot about nursing, hygiene and beauty. For today's video I'm going to be giving you some self-care tips for my nurses, obviously, in order to prevent burnout on your unit. Stay tuned. The very first thing you need to know is drink lots of water. Yes, you need to keep hydrating yourself as the shift progresses. I will tell you that you'll be walking from point A to B. Either you're going to get medications or you're going to the supply room to get, equipment for a task you need to provide at the bedside of the patient, or you might actively be, turning patients, cleaning patients, and all of that is going to entail you sweating. All of that is going to entail you maybe, going to the restroom, doing your number one. And so the very first thing I want to always advise most nurses is to hydrate yourself as often as you can. I know it's going to be uncomfortable when you keep going to the restroom, because for everything you down into your system you have to take it out. But again, I can tell you, or I cannot even emphasize on the importance of hydrating yourself. The next thing is to always make sure you have your snacks. 12 hours is a long shift for you to go all through without energizing yourself. I know there's going to be your lunch breaks, but in between you want to keep up with your snacks just to keep you energized, maybe just to even keep you up, just to keep you motivated, just to keep you going for that entire shift. The next thing I want to advise, especially the new nurses, please learn to cluster your care. When I say cluster your care, that means, let's take for example, on my step down unit, normally we have 4 patients. If you are going to attend to one patient, if you know the patient likes to get their pain medicine, if you know they like maybe some sandwich, if you know that we're asking for a blanket, a pair of socks, it will be advisable if you can just take all of that to the patient at once. In this way, this is going to prevent you from moving back and forth. I do understand that sometimes we might tend to forget, but if you can remember, please just take everything to your patient at once, so that once you're done with that patient, you know it is on to the next patient, and then from there on to the next patient. My next thing is this. I know that as nurses, so many people out there think that we are superhumans, but I don't want you to let that get into your head. If you feel like you're running behind time, please do ask for help. If you feel like another patient needs your attention whereas you are in another patient's room, do not think that you have to do everything for patient A, then move to patient B, then move to patient C. That is going to drain all the energy in you. The best thing to do in this situation is just to delegate care. Take for example, you are going into a patient's room to maybe insert a Foley catheter in patient A, and then all of a sudden patient B is calling for maybe they want an orange juice or maybe a snack. It's not going to be advisable for you to rush the process of inserting that Foley just because you want to go and satisfy or attend to another patient. The best thing in this situation would just be for you to delegate that task to the CNE. I will tell you, this has drained a lot of nurses. I can tell you that I was that nurse when I came new to the floor who thought I could do everything by myself. But by the time I realized that, hey, I had the authority, so to speak, to delegate some certain tasks to my CNA, I can tell you that I felt much more relaxed. I can tell you that at the end of my shift, I didn't feel exhausted, I didn't feel overwhelmed, because I knew that, hey, we all work as a team, and so as a team we need to work collectively to make sure that everything doesn't rely or isn't thrown on one person. So always remember to delegate certain things which you know are appropriate for certain personnel on the unit. If for example maybe you're inserting a Foley catheter and the patient needs pain medicine, do not think that you must insert that Foley and then move on to the next patient, or hurriedly insert that Foley and then move on to the next patient just to give them that pain medicine. If for any reason that patient feels that that pain medicine is very important and they cannot wait, before you get into patient A's room to start inserting the Foley, you can actually ask one of your nurses to help you give the pain medicine for that patient, or maybe to give a sleeping pill to that patient whilst you go attend to patient A. Or if another nurse is not comfortable, I can tell you most of the time the charge nurses can help you come to your rescue. The very next thing on my list is do not overwhelm yourself, especially as new nurses, to think that you have to know everything on the go. If you feel like, for example, there is a certain skill or task that you are not very familiar with, it doesn't suffice for you to try to navigate or to try to solve that problem all by yourself. If you feel that you're lacking behind because of some specific task, you can either walk up to your manager and explain the situation to them. They will be the people to look for some resources to help you, maybe some online classes, some CEs, or maybe, come up with a team of, nurses who can teach you that skill and make you much more confident in doing that particular skill. So do not overburden yourself with, hey, I do not know this, how do you go about this? If you feel that overwhelms you, please reach out, and maybe the manager or the director of your unit can bring up some resources that will help you to ease your task or to ease your job for that shift. The next thing on the list is, please, when you get home, 12 hours, 13 hours is a very long time to be working on one spot on different patients, attending to different kinds of requests and family members, taking patients from one place to the other in the hospital building for maybe treatments, procedures. I can tell you that it can get very, very tiring at the end of the shift. So please, when you go home, always make sure that you are giving yourself a relaxing bath, maybe some warm bath, drink maybe some warm milk to make you calm and feel energized, pumped up for the next day. And if you feel like a spa or treating yourself is something that you do on a regular, please make sure to schedule an appointment, and please make sure you're running for your appointment, because I can tell you that massage comes in very, very handy in making you very, very relaxed and rejuvenated. The next thing on the list is very obvious, but again, I know most of us don't follow it. That is to have a bedtime routine. You want to always make sure that at a specific time you are going to bed, especially if you have work the next day, that you go to bed at a specific time, you turn off your phone, turn off the TV, turn off your laptop, your tablet, and you are actually sleeping. And also make it a routine to get enough sleep, so that when you get to work the next day, you are actually feeling well relaxed, rejuvenated, and ready, very, very ready to start your day. My next thing, or the last thing on my list, is going to be very obvious, but I just thought I should state it here. Set boundaries for your personal life and your professional life. It won't be of any help if you're bringing out maybe issues that you have at home to the workplace. I know there can be so many dramas back at home, emotional, physical, mentally, that can take a toll on us. And we as nurses are always expected to come with a holistic mindset, because we are taking care of other individuals. And so they expect us to put on our best, to be the professionals that we are, in order to take care of our patients. So it will be in your own interest just to separate house life or your personal life from your professional life. Thank you all for staying right up to the end of this video. If you did learn so much from this video, please tell me so that I can know that I'm doing an awesome job to you all. Don't forget to like, share, and subscribe. And from me to you, it's going to be a bye, and see you in my next one. Bye guys.